Hi, my name's Morgan. I'm one of the pelvic floor physiotherapists at the Pelvic Studio. Today I'm going to go through with you some tips on how to recover after prostate surgery. We now have high quality research evidence that shows us if you practice pelvic floor muscle exercises before and after your surgery, you'll have a more hasty recovery of bladder control and erectile function. Get started by seeing your pelvic floor physio to start you off with some exercises or listen to our audio recordings. But what else can you do to look after yourself after prostate surgery? You'll have a catheter in place for 6 to 10 days after your surgery. And during the first couple of weeks, it's really important to avoid strenuous exercise. So try not to lift anything heavier than 3 to 5 kilos, avoid deep squats and lunges, avoid heavy core work or running, for example. It's best to do short, frequent bouts of gentle exercise like walking. So for example, you might go for 10 to 15 minute walks 3 or 4 times a day. The other important thing is to get some time lying down. So resting horizontally to give your bladder and pelvic floor a rest and to allow the bladder to fill up. The reason we want to be careful during these first couple of weeks is that the new anastomosis, the joint between the bladder and the urethra, is fragile during this time. You'll see your physio usually 2 to 3 weeks after your surgery to help you progress your exercises. In general though, after 2 to 4 weeks, you can start to gradually build up your exercise regime. So you can aim for 300 minutes a week of moderate exercise like walking and adding in some strengthening exercises twice a week. Your physio can help guide you on what exercise is best at this stage. The other important reason to keep exercising is that we have evidence that tells us that regular exercise can actually reduce the symptoms of treatment and can reduce recurrence of cancer and can even increase survivorship up to 60%. So there's plenty of reasons to get moving again. Eventually, after 6 to 8 weeks, you can start to progress back to more strenuous exercise. Be guided by your pelvic floor physio. At this stage, it's really important to make sure that you're confident in integrating pelvic floor action with your exercise routine. For example, being able to gently switch on your pelvic floor while you do a squat. Make sure to book in to see one of our friendly pelvic floor physiotherapists to guide you through your recovery.